see a happy face. I want to see a smiley, a land that's full of jolly. I'm ready to go, yeah. Come take me, go that place, where it is happening, where everybody dancing, where there is no blood on the dance floor, 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 blood on the dance floor. Anything you take, it's all on me. Doesn't matter if you're French or you're from Haiti. I see you, I know you see me. Let's make the world our family tree. From Africa down to overseas, you can dance on the land, you can dance in the sea. This is how it's supposed to be. Let's make happiness our destiny. I know that you care. Deep inside you want things to be fair. So follow me, let's go there, let's go there.
It is our pleasure to welcome you to this conference. Thank you so very much. So we take the presentation from Dr. Muyiwa Aina, the Executive Director, CEO, National Primary Healthcare Development Agency, here represented by the Executive Director, here represented by Director Logistics and Health Commodities, Pharmacist Hawatensi. Please can we appreciate her? She's going to speak on the topic, healthcare system strengthening and universal coverage in Nigeria.
My address is on health system strengthening and universal health coverage in Nigeria, a primary health care perspective, and the role of community pharmacy. Universal health coverage, a core target under Sustainable Development Goal, remains one of Nigeria's foremost health sector aspirations. Achieving it requires every Nigerian to access quality, equitable, people-centered health services without financial hardship. A strong primary healthcare system as the first point of contact for individuals, families, and communities is central to this ambition. The National Primary Healthcare Development Agency has championed integrated service delivery, immunization, maternal, newborn, and child health, disease prevention and community engagement, investing in facility revitalization, supply chain systems for vaccines and essential medicine, digital health, workforce expansion and community participation. The WHO defines health system strengthening as improving the 6 core building blocks of a health system: service delivery, health workforce, health information system, access to essential medicine and technologies, health financing and leadership and governance to enhance access, quality, efficiency and equity. Nigeria continues to face weaknesses across these blocks, including sector underfunding, shortages and unequal distribution of health workers, weak PAC infrastructure, high out-of-pocket expenditure, limited access to quality medicine, fragmented health information system, and urban-rural disparity. These gaps drive poor health outcomes, high maternal and child mortality, rising non-communicable disease burdens, persistent infectious disease, and limited rural access. Universal health coverage in Nigeria. Universal health coverage means all people receive needed health services, promotion, prevention, treatment, rehabilitation, and palliative care without financial hardship. Nigeria has advanced this through the presidential initiative for unlocking healthcare value chain, the National Health Insurance Authority, and basic healthcare provision funds and primary healthcare under one roof. Significant gaps remain, however, in service coverage, financial protection, and equitable access, particularly in underserved rural communities. Recognizing the roles of pharmaceutical expertise in PHC delivery, the NPHCDA has expanded its workforce by engaging more pharmacists to strengthen supply chain management and technical oversight. This builds on proven collaboration during COVID-19 pandemic. NPHCDA partnered with the Association of Community Pharmacists of Nigeria to expand vaccination services, leveraging community pharmacies, reach, accessibility, and public trust. That success demonstrated that non-traditional platforms can complement government facilities without compromising quality, cementing pharmacists as indispensable members of multidisciplinary PHC teams. The role of community pharmacy in strengthening PHC and achieving universal health coverage. As among the most accessible healthcare professionals in Nigeria, community pharmacists are strategically positioned to extend PHC services, particularly where physician shortages exist, through access to essential medicine, continuous availability of quality assured medicine, reducing treatment delays, management of minor ailments, effective care of uncomplicated illnesses, malaria, diarrhea, upper respiratory infection, minor skin conditions, allergy, decongesting secondary and tertiary facilities, screening and early diagnosis, screening for hypertension, diabetes, obesity, pregnancy, and select infectious diseases, and even timely referral, medication therapy management, medication reviews, drug interaction checks, adverse reaction monitoring, counseling, adherence support, valuable for chronic conditions such as hypertension, diabetes, asthma, HIV, and tuberculosis. Where policy permits, administering vaccines and promoting uptake, particularly valuable in high demand, high promotion and disease prevention, education on healthy lifestyle, smoking, cessation, nutrition, family planning, infection prevention, rational medicine use, and self-care. Antimicrobial stewardship, promoting national antibiotic use, discouraging inappropriate sales, and supporting adherence counseling. Referral services, identify patients needing higher level of care, facilitating prompt referral, improving continuity of care, public health surveillance, digital health and telepharmacy, which is remote consultations, chronic monitoring, medication reminders, and electronic record. But we still have some challenges limiting, these pharmacies from their contribution. Some of these limitations are limited policy recognition, regulatory restrictions on expanded clinical services, uneven distribution of pharmacies, particularly in rural areas, inadequate reimbursement for clinical pharmacy services, weak collaboration with other healthcare professionals, or integration into national health information system, medicine supply challenges, and public misconsumption. So the strategies to enhance this community pharmacy contribution to universal health coverage formally integrate community pharmacies into PHC policy and service delivery, expand scope of practice through appropriate legislation and regulation.
The ACPN National Anti-Drug Abuse Competition for secondary school students have been on for some years. Drug abuse, as we know it, is a hydra-headed problem, recalcitrant as it is, that keeps evolving. So it's a topical issue, and ACPN decided to take this gospel down to the secondary schools, to catch them young. And every year, over 100 students, 100 schools get into this competition, but usually we have only 4 finalists. Please, with a round of applause, can we bring up the champions from across the country? From Kingdom Bridge School in Gombe, Pamata Mary Kejiwa. Please, can she come up to the podium? From Divine Seeds High School in Akwa Ibom, Kini Abasi Obong David. Thomas Charles, please can we have seats for him, please? From Government Secondary School, Kwali, Abuja, FCT, Muhammad Kairat Aguye, please can we appreciate. And from King David Gifted Academy in Ebonyi, Obasi Victor Nana, please can we appreciate. These are the champions. Over 600 written essays, applications, and this was emerged from Gombe, Akwa Ibom, FCT, and Ebonyi. So they are the champions, the brainiacs. The judges, are you well positioned? They are going to do a presentation. It's not written now, this is spoken. Individually to us here, and the judges will assess them. Are you ready? So, starts with Parenta Mary Kejiwa, who is from Kingdom Bridge School, Gombe. We're going to time you. We're going to speak for 5 minutes. Thank you. Please, can we appreciate her?
Hello, Nigeria. Have you heard about a lake called Orua? Orua is a community located in Gombe State, where young children as early as the age of 14 are now turned into pigs and monsters because of drug abuse. When a research was conducted in 2008, it was noted that over 375 females now abuse drugs in Gombe State. In 2020, the drug prevalence rate of young children reached 70%. But when anti-drug abuse squads were made compulsory in 2022 in Lagos State, Nigeria, the drug prevalence possession reduced by 35%. If this can happen in Lagos, why can't it happen everywhere? Distinguished judges, esteemed guests, good morning. My name is Chichifa Paramata Mary, and I am the representative from the Anti-Drug Abuse Squad in Kingdom Bridge Schools, Gombe State, here to advocate for the establishment of Anti-Drug Abuse Squads in schools. Now, in public classrooms of typical secondary schools in Nigeria, where there are gist and castles of teenagers, lies a storm of hidden struggles. Drug abuse. Drug abuse has now become a prevalent health concern, destroying lives and finishing promising futures. One of the potent drivers of drug abuse is peer influence. In the corridors of secondary schools in Nigeria, choices are now often less dictated by parental wisdom and more by the nod of a friend or the taunt of a classmate. However, this same pressure and influence can be redirected towards resilience with the establishment of anti-drug abuse squads in schools. Weekly meetings can become safe spaces for frank conversations where the lives of young people can be improved. These weekly meetings may seem insignificant at first, but trust me, a system is being built. The goal is to eradicate drug and substance abuse among students, especially the ones in secondary schools. The purpose of this goal is to win the game, but the purpose of building the system is to continue playing the game. This is not about a single achievement. It is about a cycle of endless refinement and continuous improvement. These efforts are supported by national implementations. In 2025, the Federal Ministry of Education operated a national implementation guideline against drug and substance abuse. According to Section 8, subsection 2, Roman figure 6, there was a support for the establishment of border clubs, war against drug abuse clubs in secondary schools. Also, the Association of Community Pharmacies from 2021 to 2024 set up a program where one pharmacist visits at least 2 schools per term to support and encourage their anti-drug abuse squads. Apart from that, a
history does not remember us for the title we bear or the wealth we accumulate, but for the courage we show and the life we transform. Nelson Mandela once said, "What counts is not the mere fact that we have lived, but the difference we make in the lives of others is what brings meaning to the lives we lead." Today, as we gather here to discuss the fight against substance abuse, let us be reminded that behind every addiction, there is a story. Behind every statistic, there is a child. And behind every life saved, there is a future restored. With this sense of commitment and responsibility, permit me to respectfully recognize our distinguished dignitaries, Your Excellency, Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GTFR, the Vice President, the Senate President, State Governors, policymakers, the Chairman of the occasion, AD represented, the panel of impartial judges, invited guests, co-debaters, Association of Community Pharmacists of Nigeria, Pharmaceutical Society of Nigeria, distinguished ladies and gentlemen, good day. I feel highly honored and delighted to be called upon on a unique occasion like this. My name is Kinyama Subong David, a student of the Viking High School campus, Ikoroso of Connecticut Local Government Area, Akwa Ibom State. I stand before you today to propose the motion which states anti-substance abuse club should be created in all secondary schools in Nigeria. Before presenting my argument, permit me to define the key terms involved in the topic, substance abuse. Substance abuse refers to the harmful or improper use of drugs, alcohol, cigarette, tobacco, cannabis, tramadol, and so many other harmful substances without medical supervision. Anti-substance abuse clubs are organized groups within schools that educate students on the dangers of substance abuse while promoting healthy and responsible lifestyle. Firstly, Your Excellency, distinguished ladies and gentlemen, did you know that according to the UNODC, 14.4% of Nigerians use drugs, 14.3 million Nigerians use drugs in 1 year, about 376,000 Nigerians are high-risk drug users, and 40% of these high-risk drug users who needed medical attention never got access to it. 40%. It is easy to look at the statistics of substance abuse and view them as distant abstract numbers, but these numbers represent human lives, scattered families, and aborted dreams. By embedding structured PMN anti-substance abuse club into the foundational fabric of our educational system, we are building an impenetrable fortress against this epidemic. We are intervening at the most critical juncture of human development. Secondly, substance abuse is one of the greatest threats facing Nigerian youth. Most young people are exposed to harmful substances such as alcohol, cocaine, and other dangerous drugs. These harmful substances have negative effects on their physical health, mental well-being, academic excellence, and future aspiration. The creation of anti-substance abuse clubs has proven to be a proactive measure taken to educate students on the dangers of substance abuse before they become victims. Remember, prevention is better than cure. This club provides accurate information, helping students distinguish facts from myths about substance abuse. The evidence is unambiguous, the need is urgent, and the solution is within our reach. Substance abuse is part of secondary school life. It is a preventable crisis, and anti-substance abuse club represent one of the most practical, cost-effective, and student-centered tools available to us in the fight against it. We have seen how structured support system save lives. We have seen how empowered students become agents of change in the community. We have seen how peer education transforms attitude. But what we are yet to see, or what we must ask to create, is a national commitment to establish in every secondary school such a block, properly installed, actively supported, and proudly celebrated. The future of Nigeria is sitting in our classrooms. Let us protect it. Thirdly, my opponent may argue that the national secondary school curriculum is already too congested. They may claim that adding this mandatory club may distract students from their core academic duties. This line of reasoning is profoundly pennywise and pound foolish. Substance abuse is the ultimate destroyer of academic excellence. My opponent may argue that schools already have guidance and counseling units, making this specialized club redundant and an unnecessary duplication of function. While I respect the noble profession of guidance counselors, it is important to face the reality of Nigerian public and private school systems. Most schools have an abysmal counselor to student ratio. Your Excellency, the Chairman, Honorable Impartial Judge, distinguished ladies and gentlemen, in conclusion, the creation of anti-substance abuse club in all secondary schools is not merely an educational initiative, but an investment in the future of our nation. It protects our youth from the dangers of substance abuse, promotes academic excellence, and reduces criminal and social violence in our society. The creation of anti-substance abuse club is a structural, highly effective, and low-cost solution to a high-stake crisis. It shifts our strategy from reactive damage control to proactive systematic defense. Let us not forget that the future of Nigeria is sitting in our classrooms. Protecting them is not the option, but a priority. The question now is not if we can afford to establish this up. The question is if we can afford to lose another generation. Thank
Secondary School, Abuja, Muhammad, Kerat, Aguye. You're welcome. Please can we appreciate our faith?
The National Chairman of ACP, distinguished ladies and gentlemen, and substance abuse. Good day, I am Muhammad Kerat Aguye, Secretary of the Substance Abuse Club of Government Secondary School, Kwali, Abuja. For clarity, and substance abuse clubs are group clubs that educate students against substance abuse and promote healthy living. Today, I stand here not just to speak for my school, but to speak for many millions of students whose future depends on the decision made in this room. I stand to strongly advocate for the mandatory creation of a substance abuse club in every secondary school in Nigeria, because protecting our youth from substance abuse is not only a school responsibility, it is a national responsibility. The reality we must face. Substance abuse has become one of the greatest threats facing young people today. Many students have been introduced into harmful substances such as tramadol, cocaine, alcohol, tobacco, and other illicit drugs because of peer pressure, curiosity, stress, or simply because no one taught them the consequences. We have instances in secondary schools where it became a painful reality when the students suffered a drug-related crisis requiring an emergency intervention. Those incidents is not just as waiting until security agencies to arrive at our schools
is why we need a substance abuse clinic in every secondary school in Nigeria. God bless the Federal Republic of Nigeria. Thank you.
From King David Gifted Academy Ebonyi, Obasi Victor Nana. Please can we appreciate him?
A good day to this honorable house. If you are ready to join the fight against drug abuse in Nigeria, when I say drug-free club, you respond, say no to drug abuse. Drug-free club? Drug-free club? I want to start by recognizing the presence of the Secretary to the Government of the Federation, Your Excellency. You are welcome, sir. I also recognize the presence of the Chairman of the occasion, the special guest of honor, my fellow students, distinguished ladies and gentlemen. My name is Obasi Victor Nana from King David Gifted Academy, Abakaliki, Ebonyi State. I stand firm, strong and unshakable here today to tell this honorable house practical reasons why anti-substance abuse clubs should be established in every secondary school in Nigeria, stating the efforts of the drug-free club in my own school, King David Gifted Academy, in combating drug abuse in Nigeria. The issue before us today is as topical as it is relevant. Drug abuse has become a pervasive global public health challenge and as such requires concerted efforts to combat it. The health institutions here, our parents, the schools, and indeed all and sundry must join the fight against drug abuse. What then is drug abuse? Drug abuse, according to the World Health Organization, is the harmful or hazardous use of substances which negatively affect an individual's physical and mental well-being. Globally, 26th June has been mapped out as World Anti-Drug Abuse Day. This is a step taken in the right direction to create awareness against the dangers of drug abuse, to address these attendant challenges, and to stress the need to steer away from drug abuse. In our efforts as King David Gifted Academy to support this fight, in 2021 we established the Drug-Free Club with the aim of combating drug abuse among students. Its objectives are: 1. To educate the students on the dangers of drug abuse, 2. To ensure a drug-free environment for the students, and 3. To nurture and groom students who will have a distaste for drug abuse both within and outside the school environment. These three objectives form the parameters through which our students are nurtured and sensitized against drug abuse in relation to the causes, consequences, and solutions to drug abuse. In our efforts to combat drug abuse, we carry out weekly sensitization of our students. In this weekly sensitization, resource persons, mainly health experts, are invited to talk to our students and sensitize them on the need to stay away from substance abuse. In our secondary schools today and even our higher institutions, we have scenarios where a student who can smoke and drink excessively is known as a guy man, while a student who cannot is known as a Jew man. My submission here is that in our club, we sensitize our students not to fall prey to such level of intimidation or pressure. We sensitize our students that this drug abuse has severe consequences. And as such, we tell them that it is better to be a Jew man and preserve one's future than to be a guy man and destroy one's life. We also have scenarios. We do not only educate students on the dangers of drug abuse, we also rehabilitate students who have already indulged in drug abuse. Another case study was a student who was from another school who indulged in substance abuse and was invited to our drug-free program by one of our students. I tell you today that that student was deeply inspired and today is no longer a drug abuser. Coming to the consequences of drug abuse, we sink deeply into the minds of our students the dangerous consequences of drug abuse. We have a scenario where a group of boys, they were smoking and drinking, and along the line, security agents caught up with them and they were arrested. In such a situation, before one would be given the opportunity to explain oneself, One must go to the station, one must write a statement. And no matter how true your statement will be, it has cost you your studies, your time, your money, and your freedom. Hence, we educate our students at the Navy Gifted Academy that drug abuse has severe consequences. And as such, we formed an acronym which we call Mrs. Vedu. This acronym highlights the consequences of drug abuse, which are madness, rape, stealing, violence, expulsion, disobedience, untimely death, and loss of concentration. To ensure that our school remains drug-free, we as the Navy Gifted Academy ensure that the school remains drug-free by making sure that our students do not have access to alcohol or drugs except the one prescribed by the doctor. We also make sure that students' hostels and bags are thoroughly searched periodically to avoid any form of smuggling or hidden use. I therefore call on the government, health institutions just like ACPN is doing today, our parents, family, and indeed all of you here present to join this fight against substance abuse while making anti-substance abuse club a mandatory component of every secondary school in Nigeria. Thank you, and may God bless the Federal Republic of Nigeria.
Good afternoon, everybody. Please, I want us to understand that this stage is a very important stage in the life of these our young students. We are winners. I want to tell you that you are all winners. But since this has been a competition, one person must match. I want to tell you that this platform has actually provided a good opportunity for your future endeavor. Please don't relent. Take this message to your schools and encourage other young chaps like you. And actually, the future of Nigeria is actually bright. I want to also encourage the teachers and the coordinators and the parents of these students. You have actually achieved a great feat by actually coming to this point in time. They are all special students. I want to congratulate you on advance. And as we take the results, on behalf of the judges, I want to announce the result of this competition. I will start from the third runner-up. I will stand from the third runner-up. I want to call on Mohammed Karita Agunye. Thank you. Congratulations.
I was built to be the best, number one and nothing less. Lead me to my destiny. I have waited patiently.
And this winner, Mohammed Kairat Aguye, has won for herself 100,000 naira. Thank you very much. Prof.
The second runner-up is Obase Victor Nnanna, King David Gifted Academy, Ebonyi State.
Let's have his prize and certificate. Mrs. National Chairman, please help us present the certificate first. And then, of course, Obasi Victor Nnanna has won for himself 150,000 naira.
Yes.
Thank you very much.
The first runner-up, Pemeta Mary Kanjiwa, Kingdom Breed School, Gombe State. Congratulations.
Wow.
First runner-up.
Pameta Mary Kejivi has won for herself, ladies and gentlemen, aside the certificate of participation, 350,000 naira. Smile small now, Pameta.
Smile.
Thank you. Congratulations. It pays to work hard.
Yes.
And these are impartial judges and incorruptible judges that have done this. Prof.
Thank you. Yes, the overall winner of this competition, and I'm privileged to announce Kenny Abase David Obang of Divine Seed High School, Akwa Ibom State. The overall winner. Thank you.
Be the best, number one.
And ladies and gentlemen, Kenny Abase has won for himself 500,000 naira.
I have vision, though I believe. I know I can count on me. So stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up. It's just life, that's how it is. Cause we have our strengths and weaknesses. Oh, I have vision, can't you see? I'm on the move.
And I'll be speaking to us briefly about managing hyperpigmentation in community pharmacy. Thiamidol, an innovative and a first-line solution. Very quickly, I work with a company called Biosdorf, the makers of Nivea. However, we are responsible for Eucerin, which is the medical grade formulation, that is dermocosmetics formulation of Biosdorf. And I'll be taking us through our solutions. Biosdorf has been around for over 125 years, and Eucerin as a brand is the first ever dermocosmetic brand founded by a pharmacist, which is one thing that makes me excited about the brand. Over the years, we've had a series of innovative solutions ranging from sunscreens, hyaluronic acid, urea formulations for dry skin, as well as the most recent ones, Thiamidol, the first human thyroid enzyme inhibitor that effectively and safely treats hyperpigmentation. And lastly is the Epicelline that reverses age drop for almost 5 years back. Our solutions cut across different disease areas of the skin, including dry skin, hyperpigmentation, sun protection, dry skin, as well as photoaging. Okay, so today we're just focusing on our solution for hyperpigmentation, and that is Thiamidol, an innovative solution for hyperpigmentation. First, about 46% or more of our patients present with uneven skin in the community pharmacy. And pharmacy being the first point of call for most patients globally and even locally, we will be seeing a lot more of these concerns present over and over. However, we always face the challenge of managing this because the current standard of care, hydroquinone, is both, while it is effective, it is unsafe. And you can confirm that most of the patients who have been exposed to hyperpigmentation or who use hydroquinone will always come down with both systemic as well as skin side effects. And that is why our Thiamidol comes in very handy as safe and effective for management of hyperpigmentation.
Good morning once again, my fellow professional colleagues. As we can see, Nature Seed is here today because of the support community pharmacy has given to the company. And Nature Seed, one of our vision is to also identify with the vision of every various community pharmacy professional. That is why, for many years now, we have been empowering, supporting community pharmacy practice, especially during our Africana night in partnership with ACPN. in where we understand that there's a logistic operational cost to running the business. Where we make available free SUV, where we give out SUV, where we also give out refrigerator, freezer, especially for our products that are cost sensitive. In various ways we have been supporting. But now we have identified that there is a pain point in running our business. We actually want community pharmacy business to expand as we also increase. And one of the pain points is power supply. We are in FCT today. We all know, we've also heard what is also happening in Secordary, Asorok rather, in terms of putting inverter and solar there. So but for our business, we know the cost that we expend every month. A typical pharmacy outlet spend almost 300,000–400,000 naira on diesel, on fuel. So because we want community pharmacy to grow, and we want to ensure to be able to address these challenges in terms of reduced profitability, also address operational costs, and also the issue of limitation of business expansion. That is the reason why Nature's Field, Silken, is working hand in hand with ACPN. ACPN, National ACPN, State ACPN, Zonal and Branches ACPN. We want to reduce operational costs. We want to reduce financial burdens and debt in terms of what? Fraud, in terms of getting a big generator. We want to ensure that in the businesses you run, there's availability of what? Safe funds. And also to make sure that you are able to maximize your what? The business you have set up to do. Then also to identify with green energy. That is why today, this moment, we are happy that we are offering and addressing one of the typical pain points in the running of the what's called retail community pharmacy. Yes, we've seen situations that third party banks come that, oh, we give you inverter solar, but we are spending from our profits. We are spending from the money that we would have used to expand our business, to also create more chain stores, to also grow, or also improve in our life. That is why we are here today. And over to you, Madam Mary.
Ladies and gentlemen, our esteemed professionals, once again I welcome you all. Nature's Field Second Limited is particular about every retail pharmacy. It's a win-win business and we both have to grow. And this is where we come to support you all. Having spoken about this beautiful and laudable project, we have different categories for everybody. First of all, we have a project that every retail store will do 1,500 units of our selected products within 6 months. 6 months. And then they get a 6-unit, 620. We have actually upgraded from a 550-watt solar panel system to a 620-watt solar panel system for you. In addition to that, this category is going to be getting a 1-unit, 5 kilowatts per hour lithium-ion battery. We all know that the lithium battery is actually the best if you want to power your inverter. And then this same category will also go with a 1-unit, 3.6 kilowatt inverter. Now let's go. This group or this category or this load capacity is going to help you carry 15 LED lights at 10 watts, 2 televisions in your pharmacy, 3 fans, 1 fridge, 2 PCs, your laptops or your desktop, and a sound system. So you can actually get this having bought 1,500 units of our selected Nature's Field products.
First of all, Mr. National Chairman, let me appreciate Nature's Field. For a long time they have been investing in our program, ACPN programs. But I think this one is the big one. Because without power, you cannot do much in your pharmacy. And just like the presenter said earlier on, the banks come, they take your money, and you end up with little value for what you get. But being a professional pharmacist himself, I believe that this will go a long way to improving our practice. So, on behalf of all of us, it's a great honor and pleasure. We congratulate you very much. You're not eating alone, you're sharing the thing with us as we unveil this product. I want to believe that it's not only buying. Look at people like that. You just carry one and go there, and then the man will now bless you. So you just see that your product will be selling non-stop. On behalf of all of us here gathered, this is good news. So let us all unveil it. Incidentally, on behalf of all of us, we unveil it, and the Almighty God will make this thing useful to community pharmacists and also useful to the development of healthcare delivery in Nigeria. Amen?
I want to sincerely thank everybody who is seated here. I don't know how to start, but I want to appreciate our colleagues. Our colleagues have been with us right from the first day we started working and introducing this brand to Nigeria, Naturefield. And we have had the best support from all our colleagues. And every single thing we do here since we started is keep on supporting our colleagues and see the areas we are going to work together. This is just a starting point. We want the pharmacy stores to work. We want our colleagues to close their stores, have an AC in their place, be able to work as a professional pharmacy outlet. So we really want to encourage a lot of our colleagues to sign up to this project, and we will be sure that all the things we are going to install are quality solar system. I am going to be sure of. Thank you once again, and God bless you.
I know you're not strangers to Emzor. There's nobody here, I make bold to say, that has not used an Emzor product. If you've not used an Emzor product ever, can you raise your hand? It's not possible, don't worry. Thank you very much. So today I'll be talking to you about an initiative that we have called Strengthening Maternal and Child Health Through Prevention. And the reason is because we understand how important the role of community pharmacists is in preventing some kind of mortalities, especially when it comes to mothers and children. And the reason we are here today is because every single day, you, community pharmacists, you help a child recover fast, you help a child to survive malaria, you help to determine whether a mother is going to successfully carry their pregnancy to term. And you also help to determine whether a family is going to receive timely interventions that are both cost-effective and treatment-effective. So today is essentially how we can do more together. And I would just like to remind us of a few things. There are certain things in Nigeria that contributes to the highest mortality rates when it comes to mothers, when it comes to children, and even generally. For children, at least 30% of the mortality is still due to malaria. We still have pneumonia. For mothers, we still have postpartum hemorrhage. You might be wondering, why is all of this important? Even vaccine preventable diseases. I would like to show you just a quick snapshot of what Emzor has done. So looking at 12 broad areas that contribute a high rate to the mortality in Nigeria, you have an Emzor solution at every point. Starting with vaccine preventable diseases. I know that so many of us here have been beneficiaries of the trainings that have been sponsored by EXO for pharmacists to be trained vaccinators to ensure that we can prevent some diseases before they even start. And then also talking about high rates of maternal mortality. Our Zolan portfolio, our Zolan subsidiary, currently have invested heavily in ensuring that we have products that can prevent postpartum hemorrhage. Postpartum hemorrhage is still a leading cause of maternal death. We also have the products that can also help to aid cervical ripening and also prevent eclampsia.
I just want to mention some of our products that are tailor-made for community pharmacies. Our POS has the highest success rate currently in Nigeria, 99.99. We decided to take that part off because only God is perfect. We could have said OPE is perfect. But currently we run on 99.99% success rate. Currently in Nigeria, we have 22 million daily active users. Just saying that in a day, 22 million people use OPE. That is what we have. In fact, it's a third-party data. But to speak to the products that are more useful to community pharmacy, our POS, like I said, the success rate is 99.99. Now we have a QR code, which means that for your community pharmacy, you will never at any point have an issue of a mix or error payment. Instead of typing the account number where somebody will make mistake of 1 or type 0, now you scan the QR code and immediately the person can make payment. We are the first and the only one currently doing that. And also to speak to our products. Currently, we are trying to partner with community pharmacy and see how we can help their cash flow. We understand how this business run, that you need money to expand, you need money to run your inventory. Therefore, we brought out our term loan, in which community pharmacy can have access to funds, to loan. And we give the best rates currently in the country. As a matter of fact, I may have to say it here, that if I give you 50 million naira OPE, in 6 months, you are going to pay 54 million back. No bank is going to do that. Yes. That is currently what we give to people. And that is because we are trying to see how we can help businesses to expand, how they can have cash flow to do more business. Because the more they do business, the better it is for us. Now we have, on our POS, there's international card acceptance. It means your Revolut, your Master, any card coming from US, coming from UK, on our POS, you can collect your money. You don't have to, they can't tell you that they don't have Naira or they don't have Naira card. That's why they are not buying. Once you are using OPE, any card works and you collect your money in Naira. No hassle at all. Now this is our dashboard. For anyone that uses OPE, with this dashboard, you can see your inflow. You can see how much has come in. You can compare it with yesterday. So you know if your business is doing well or not. It helps you for easy reconciliation. Now, this is for businesses that have distributorship. You have people under, you have sales rep. We create a wallet for you that as soon as the client or your merchant is paying, immediately you see the money in your account. This is going to help unidentified payment. For pharma industries that they don't know who made payment, immediately you are going to see the payment. And also we have our online payment gateway for businesses that have e-commerce. If you come on board, we have a product called Pay with OPE. Immediately you click, it takes you into OPE app. You don't have to type the amount so you don't make mistake. Just put your PIN and it takes you back. Seamless, a closed loop system that OPE has for you. Yes, this a vendor management product that we develop for businesses that have multiple suppliers. So on your dashboard, you can have all your suppliers there. They send the invoice, you make payments, you can decide to make part payment or make full payment. So you will never lose your invoice. They're not going to come tomorrow and say you have not paid because you have it on your dashboard stored there for you with OPE system.
Let's go there.